I'm going to show you how to do a slump slider or a flosser, whatever you want to call it. It's about trying to move your nervous system. It's not about stretching it ever. And it's really important to listen to your body, so you have to go very slowly. Because if you go too quick and you go too far, you might really irritate the nerves that are going down the leg. And that is not the point. We're trying to calm them down. We're helping them to move more freely and desensitize. So you're going to start when you're laying on the side. So the problematic side is the one that's on the top, okay? You can have a pillow underneath here that makes you more comfortable. Some people have to start where their chin is tucked down. For the purpose of this video, to talk to you, I'm not going to look down, but I'm going to have it slightly flexed. Your knees are just kind of bent about 90 degrees at your spine, and they're on the edge of the bed or the couch or whatever gives you good support and you feel safe. You can either have the bottom leg falling off if that's more comfortable. I don't find it often is, but if it is for you, go for it. You want to take the leg that's problematic. So you're likely having either problems in your bum or down the back of your leg or into your foot with this top leg. So this leg is my left leg. I start with curling my toes to my ankle. So it looks like bending up. So it's going towards your head, okay? So the toes are coming up in this position. That might be a little bit of pull, but shouldn't be very much. It's this adding in when I slowly, keeping my toes up, slowly straightening my knee. Okay, if I get to this point, I might start to feel a little pull in the back of my hamstring, or my calf, or my bum, or in my back, okay? If I get to that point, I've lifted my toes up and I've gotten slowly to the point, I'm like, oh, there's that little pull. If I look up with my head and it changes and it goes away, that would allow me to then extend a little bit more, and that might bring on that same pull again. At that point, I would point my toe and hopefully make them completely go away. So it would look like this. Again, my chin would be down a little bit more, so that creates a stretch on the back of my neural tissues near my spine, my upper spine. I curl my ankle up. I slowly extend. When I get to that point first, I can either move my head, like I'm doing right now, by looking up. It might ease that completely, and if it does, wonderful. If it doesn't, you come back out. You do not push through that tension. The other option is just switching that. I keep my head down, I curl my toes up. I slowly extend. When I get the pull, I point my toe right away. I haven't moved my head this time. I might slowly be able to extend that knee a little bit more. Oh, and there's that pull again. And then I can release it potentially with my head. And then I bring it back down. You notice I'm never going to hold. If I were to do this without trying to teach you, it would look like this. Oh, I'm bending up my ankle. Oh, I'm feeling that tension. I'm going to take away my tension by pointing my toe right away. Maybe I can go a little bit straighter. Oh, there's the tension back. And now I've taken it away and I unload. It's kind of at that rate and that speed. So you don't ever pause where the hold is. You want to go back and forth, probably, I would say at least 5 times at once, maybe 10 times. And depending on how severe it is, the more you kind of do it throughout your day, especially if you're just in a lot of pain, the more you give that sense of release and movement. So maybe once an hour, you do it 10 times, and then slowly pulling it back to maybe needing it way less. But that is kind of like where you start and where you're kind of going to, well, maybe I can just do it once a day, and that's enough to kind of let my system kind of desensitize.